I'm Dr. Vishnu K. Ramesh. I'm an emergency physician, which means I'm one of the specialist doctors who's qualified to attend to all your emergencies and also provide a comprehensive healthcare to people of all ages. I work at the NHS, the National Health Services at UK. As you can already say, this is my first video on the channel. And why did I want to make videos in the first place? Because I was bored? No, I'm just kidding. So, through my years of medical and specialty training, I've always come across a lot of patients who tell me that, oh, I didn't know I had to do this. Oh, I didn't know I had to come to the hospital earlier. I would have done it if I had known. So, I wanted to fill this awareness gap by talking to people about recognizing and responding to out of hospital emergencies through my laid back chill videos. That's my first video. So today's video is going to be about a condition that's pretty much been the call of the hour for the past few decades now. Heart attack. We understand that every part of the body needs blood to live. So does the heart. The heart needs blood to live. So when the blood supply to the heart comes down, the heart muscles start dying. This is called as heart attack, also called as myocardial infarction in medicine. So I think we should stick to heart attack because it sounds more dramatic. There are nearly 3 million cases being reported in India annually, making heart attack a leading cause of death in India. There are numerous reasons to which a heart attack can occur. Most importantly, the blood vessels that take blood to the heart. Let's call it a pipe. The pipe that takes blood to the heart gets clogged with cholesterol and a blood clot, which causes the blood supply to the heart to stop and thus causing the heart muscles to start dying, and it's called heart attack. So what does your doctor do now? He's going to try various methods to try and unclog the pipe using medicines and procedures so that the blood supply to the heart is restored. Well, let's talk about how a person feels when he has a heart attack. Or let me put it this way. So, what are the symptoms that tell you that you need to be in the hospital? There are only 4 things to remember. First things first, chest pain. So, the pain feels like heaviness over the chest, and most often people describe it like they feel like somebody is sitting on their chest. So it feels that heavy over the chest. And number 2 is breathlessness. The patient can feel breathless with a chest discomfort. And number 3 occurs with number 2 and number 1. It's always in association with them. So number 3 is profuse sweating. So the patient can come in with a chest pain and profuse sweating, or breathlessness with profuse sweating. The patient, sometimes when they come to the emergency, they are drenched in sweat like they've taken a bath. So that is the profuse sweating that you can expect. And number 4 is dyspepsia. Fancy word, isn't it? So dyspepsia is a feeling of indigestion in the upper abdomen. So yeah, oh yeah, heart attacks can even manifest as a feeling of indigestion over the upper abdomen. So wait till it gets more interesting. There's a guidelines in India that even say that men more than the age of 25 with the feeling of dyspepsia need ECG to rule out a heart attack. It has become that common in India. If you happen to witness somebody, or you find yourself in a situation where you think you have a suspected heart attack, what do you do now? Step 1, do not panic because you know what to do next. Step 2, would you like to run to the hospital? No. No running, no walking, no exerting yourself. Stay calm, call for help, call an ambulance or hail a cab, and then reach the hospital. Because exerting yourself is just going to worsen the situation because your heart will need more blood from a clogged pipe. Step 3, position yourself or the victim. Sit him up straight because it will make the breathing easier. No lying down anywhere, even on the transport. So as soon as you reach the hospital, you'll have an emergency physician take over for you. And you've recognized and responded well to the emergency situation, and you've done it right with confidence because you've spent your time wisely by choosing to watch this video. person with a suspected heart attack to the hospital is not the only best thing you can do. You can even start the medication even before you reach the hospital. But for this, you'll have to know more about the three golden drugs that you need to have in your closet or in your pocket, which I will be talking about in my next video. Do like, share, and subscribe the video so you can keep filling your awareness gap. Of course, this is way more important and interesting than talking about the stock market. And do comment if there's anything you'd like to know more. Bye.